The top 8 vitamins that seniors swear by for stronger pain-free legs. Imagine waking up each morning, your legs feeling robust, steady, and brimming with energy. No more muscle weakness, no more agonizing cramps, and no more anxiety about balance or falls. If your desire is to remain active, independent, and confident, the key lies in targeted nutrition. Today, we're unveiling the 8 most potent vitamins and minerals that will empower your legs, making them strong and resilient. From amplifying muscle function to safeguarding bone density and enhancing circulation, these vital nutrients can significantly transform how you move and feel daily. Whether you cherish leisurely park strolls, the joy of dancing, or simply maintaining your independence, this video is tailored for you. Before we proceed, I'd love to know where you're joining us from today. Share your location in the comments below and feel free to ask any questions. And of course, hit that subscribe button and turn on notifications so you never miss out on our premier health insights. Let's forge a healthier, stronger future together. First, let's delve into vitamin D. As we age, our bodies undergo inevitable shifts. Muscle mass diminishes, bones lose density, and movements once effortless can become increasingly challenging. A frequently overlooked factor in this decline is vitamin D deficiency. This isn't merely about fragile bones. This vitamin plays a pivotal role in maintaining leg strength, balance, and functionality. Let's explore why vitamin D stands as the most crucial nutrient for leg strength in older adults, and how ensuring adequate intake can revolutionize mobility and overall well-being. As we age, our skin's efficiency in synthesizing vitamin D from sunlight decreases. Compounding this, many seniors spend less time outdoors due to mobility limitations, lifestyle changes, or concerns about skin damage. This results in a widespread deficiency that silently erodes muscle strength, leaving legs weak and unstable. Studies consistently link low vitamin D levels to muscle weakness and an elevated risk of falls in the elderly. Research published in the Journal of Clinical Endocrinology and Metabolism revealed that seniors with sufficient vitamin D levels exhibited stronger muscle fibers, superior coordination, and improved balance, making them less susceptible to injuries and fractures. Conversely, those with a deficiency experienced accelerated muscle loss, making basic activities like climbing stairs or rising from a chair more difficult. Vitamin D extends beyond calcium absorption and bone health, although those are vital. This powerhouse vitamin directly influences muscle function by enhancing protein synthesis and improving neuromuscular communication. Envision it as fuel for your leg muscles. Without it, they struggle to perform optimally. Research indicates that vitamin D is pivotal in maintaining fast-twitch muscle fibers, crucial for quick reactions and balance. These fibers help prevent falls by enabling rapid leg responses when balance is compromised. Without adequate vitamin D, these muscle fibers deteriorate, leading to slower reaction times, weaker muscle contractions, and a higher injury risk. Additionally, vitamin D has been shown to mitigate inflammation in muscle tissues, alleviating chronic pain and discomfort experienced by many seniors in their legs. Those plagued by frequent cramps, stiffness, or unexplained leg pain might be surprised to learn that optimizing vitamin D levels can provide significant relief. Ignoring vitamin D deficiency doesn't just weaken legs, it opens the door to serious health issues, most notably osteoporosis and fractures. Without sufficient vitamin D, calcium cannot be properly absorbed, leading to brittle bones prone to breaks. A minor stumble could result in a major fracture, severely impacting mobility and independence. Beyond bones and muscles, vitamin D deficiency has been linked to increased risks of heart disease, cognitive decline, and weakened immunity. Seniors neglecting their vitamin D intake may not only suffer from weak legs, but also face a higher likelihood of chronic illnesses that further diminish their quality of life. The solution? Ensuring optimal vitamin D levels is straightforward and yields life-altering benefits. Effective ways to boost vitamin D include sun exposure, spending 15 to 30 minutes in direct sunlight, preferably morning or late afternoon, exposing arms and legs for maximum absorption, but being mindful of sunscreen use, as it can block vitamin D synthesis. Vitamin D-rich foods. While food alone may not meet daily needs, incorporating fatty fish, salmon, mackerel, sardines, fortified dairy, egg yolks, and mushrooms can contribute to intake. Supplements. For many seniors, particularly those with limited outdoor time, a vitamin D supplement is essential. Most experts recommend 800 to 1,000 IU daily for optimal bone and muscle health, though higher doses may be needed for severe deficiencies under medical supervision. If unsure about your vitamin D levels, a simple blood test provides clarity. Many doctors now routinely check for vitamin D deficiency in older adults, recognizing its critical role in preventing falls and fractures. 2. Calcium. Unlike younger individuals whose bones are still remodeling, seniors experience gradual bone mass loss, making them more fracture-prone. This is particularly dangerous for the legs. Hip fractures, femur breaks, and stress fractures in the lower limbs are among the most serious injuries older adults face. A minor fall that might have been harmless in youth can result in months of recovery or even permanent mobility loss when bones lack necessary calcium reserves. Calcium's role extends beyond bone strength. It is vital for muscle contraction. Every movement, from taking a step to rising from a chair, relies on a complex interplay between calcium ions and muscle fibers. Calcium acts as a trigger for muscle contraction, ensuring smooth, controlled movement. Without adequate calcium, muscles may cramp, feel weak, or fail to generate the force needed for stability. This is why many individuals with calcium deficiency experience frequent leg cramps, sluggish movement, and reduced muscle endurance. How to ensure adequate calcium intake? While dairy products like milk, yogurt, and cheese are rich sources, leafy greens, kale, bok choy, almond tofu, sardines, and fortified plant-based milks also provide excellent calcium. Variety is key. Incorporating multiple calcium sources ensures steady absorption and better bone maintenance. However, food alone may not suffice, especially for those with dietary restrictions or absorption issues. Calcium supplements can play a valuable role, particularly when combined with vitamin D, which enhances calcium absorption. Yet excess calcium, especially from supplements, can lead to artery deposits, kidney stones, and digestive issues. The recommended daily intake is 1,000 to 1,200 mg, preferably from natural foods and supplementation when necessary. Beyond intake, movement is crucial. Weight-bearing exercises like walking, resistance training, and light jogging stimulate bone remodeling and direct calcium where needed. Neglecting calcium intake weakens bones and robs individuals of free movement, engagement in activities, and independence. A life of mobility, stability, and confidence begins with strong bones and well-functioning muscles, both reliant on calcium. 3. Vitamin B12. While leg strength often revolves around calcium and protein, vitamin B12 plays a fundamental role in neuromuscular function. It ensures healthy nerves, maintaining strong and precise electrical impulses through the spinal cord to the legs. Without it, muscles don't receive the right signals, leading to weakness, instability, and loss of movement control. A common symptom of B12 deficiency is heavy, tired legs, often with numbness or tingling. Vitamin B12 deficiency is shockingly common among older adults. Unlike other vitamins stored in fat or absorbed through various foods, B12 absorption depends on digestive health. The body needs adequate stomach acid and intrinsic factor to extract B12 from food. As we age, stomach acid production decreases, and conditions like gastritis, acid reflux, and antacid use impair absorption. Diets low in B12-rich foods result in a slow depletion of this nutrient. B12 deficiency extends beyond weakness. It can lead to irreversible nerve damage, affecting balance, coordination, and reflexes. Many seniors with frequent falls, walking difficulty, or legs not working as they used to are experiencing neurological effects of B12 shortage. The decline is often gradual, dismissed as aging, but it's preventable. Restoring B12 levels improves mobility and energy. Studies show seniors correcting their deficiency experience strength, endurance, and leg function improvements. Vitamin B12 is found almost exclusively in animal products: lean meats, fish, eggs, dairy, and shellfish. For plant-based diets or absorption issues, B12 fortified foods or supplements are essential. Vitamin B12 is safe to supplement as excess is excreted in urine. Many older adults benefit from high-dose supplements or injections, especially with absorption difficulty. Regular blood tests ensure optimal levels and prevent leg function decline accompanying deficiency. Strong legs involve nervous system efficiency, reaction time, and coordination. No matter how much you exercise, if your nerves don't fire correctly, your legs won't respond properly. Maintaining adequate B12 levels is a powerful strategy for preserving mobility and quality of life as you age. 4. Magnesium. Magnesium plays a behind-the-scenes role in smooth muscle contraction and relaxation, acting as the master regulator of muscle function, preventing spasms, reducing fatigue, and supporting endurance. A common symptom of magnesium deficiency is restless leg syndrome and nighttime leg cramps. Many seniors experience sudden painful muscle contractions in their legs, particularly at night, disrupting sleep and recovery. This isn't just discomfort, it's a sign of the body struggling to regulate muscle relaxation. Magnesium calms overactive nerve signals and prevents unexpected muscle seizures, essential for those with muscle tension and involuntary contractions. Magnesium is also vital for bone density and joint health. Calcium needs magnesium to do its job effectively. Magnesium regulates calcium transport and ensures proper incorporation into bones, not soft tissues, where it could contribute to stiffness and joint pain. Studies link higher magnesium intake to greater bone strength and reduced fracture risk in aging adults. Magnesium deficiency is common due to depletion by stress, medications, and poor diets. Many older adults take medications that lower magnesium levels, including diuretics, proton pump inhibitors, and certain blood pressure drugs. Coupled with diets low in magnesium-rich foods, the result is widespread deficiency that quietly chips away at strength, endurance, and flexibility. This is why many seniors experience a gradual loss of stamina, walking shorter distances, climbing stairs more slowly, and feeling fatigued after simple activities. It's not just age, it's a lack of the right nutrients to fuel performance. Replenishing magnesium levels can have an almost immediate effect on leg health, reducing cramps, improving energy, and restoring a sense of ease in movement. The best dietary sources of magnesium include leafy greens, nuts, seeds, whole grains, and legumes. Foods like pumpkin seeds, almonds, spinach, black beans, and avocados are particularly rich in magnesium, offering a natural way to maintain muscle and bone health. However, for those who struggle to get enough through diet alone, magnesium supplements can be an effective solution, especially magnesium citrate or magnesium glycinate, which are more easily absorbed by the body. The transformation that occurs when magnesium levels are restored is remarkable. Seniors who once felt heavy and sluggish find that their legs respond with renewed energy. Those who suffered from frequent muscle cramps or stiffness notice relief, allowing them to sleep better and move more freely. Even balance and coordination improve, as magnesium helps regulate the neuromuscular connections responsible for steady movement. 5. Potassium. Imagine waking up in the morning, stepping out of bed, and feeling an immediate cramp in your calf. Sound familiar? Muscle cramps are one of the most common symptoms of low potassium levels. This is because potassium acts as a key regulator of muscle function, helping to balance fluids inside and outside of muscle cells. When potassium levels dip too low, muscles contract involuntarily, leading to painful cramps, especially in the legs. And for older adults who may already have reduced circulation or muscle mass, these cramps can be more than just an annoyance. They can be debilitating. But muscle cramps are just the beginning. Have you ever felt your legs trembling after standing for a while? Or maybe you've noticed increased stiffness when walking. Potassium is responsible for transmitting signals between nerves and muscles, ensuring smooth, controlled movements. When levels are low, the communication between your brain and your leg muscles becomes less efficient, leading to shakiness, weakness, or even difficulty lifting your feet properly, something that can significantly increase the risk of falls. And let's face it, for seniors, avoiding falls is crucial. Beyond muscles, potassium also plays a surprising role in maintaining strong bones. It helps neutralize acids in the body that can break down bone density over time. Studies suggest that a potassium-rich diet can slow the rate of bone loss, reducing the risk of osteoporosis, and keeping the legs structurally strong. So, in many ways, potassium isn't just about muscle function. It's about ensuring that both the muscles and the bones in your legs work together in harmony. Now, the big question: how do you ensure you're getting enough potassium to support your legs? Fortunately, nature has provided us with an abundance of delicious, potassium-rich foods. Bananas might be the first thing that comes to mind, but they're just the beginning. Sweet potatoes, avocados, spinach, beans, and oranges are all excellent sources of potassium. Even a simple baked potato with the skin can provide more potassium than a banana. The key is to incorporate a variety of these foods into your daily diet, so your muscles and bones receive consistent nourishment. For those who struggle to get enough potassium through food alone, supplements might seem like an easy fix. So, how much potassium do you really need? The recommended daily intake for adults is 2,600 mg for women and 3,400 mg for men. This amount is typically achievable through a well-balanced diet rich in fruits, vegetables, and legumes. However, individuals with health conditions that affect potassium levels, such as kidney disease or high blood pressure, should monitor their intake carefully and work with a doctor to determine the right amount. 6. Vitamin K. When people think of vitamins essential for strong bones, calcium and vitamin D often steal the spotlight. But without vitamin K, these nutrients cannot do their job properly. Vitamin K is the critical link that ensures calcium is deposited in bones where it belongs, rather than accumulating in arteries or soft tissues, where it can lead to stiffness, poor circulation, and even cardiovascular disease. In other words, vitamin K acts as the traffic controller, guiding calcium to the right places and keeping your legs structurally sound and mobile. For older adults, this becomes even more crucial. Studies have shown that individuals with higher vitamin K intake have stronger bones, lower fracture risk, and better overall bone health compared to those with low levels. That's because vitamin K activates osteocalcin, a protein that binds calcium to the bone matrix, making bones denser and more resistant to breakage. But vitamin K's role doesn't stop there. It's also an essential nutrient for joint health and muscle function. Many people overlook the fact that healthy legs require not just strong bones, but also flexible joints and well-functioning muscles. Vitamin K has been shown to reduce inflammation in the joints, which can slow the progression of osteoarthritis and alleviate knee stiffness, a common complaint among older adults. If your knees ache when you move or feel stiff after sitting for too long, vitamin K might be the missing nutrient that could help ease discomfort and keep you moving freely. Poor balance, difficulty walking, and an increased risk of falls are often linked to weakened leg muscles. Emerging research suggests that vitamin K helps support muscle strength and coordination, particularly in aging adults. It does this by regulating calcium levels within muscle cells, ensuring proper contractions and preventing the kind of uncoordinated movements that can lead to instability. Spinach, kale, Swiss chard, collard greens, and Brussels sprouts are some of the richest sources of vitamin K1, the form most commonly found in plants. However, another powerful form of the vitamin K2, is found in fermented foods like natto, fermented soybeans, aged cheeses, and certain animal products like egg yolks and liver. K2 is particularly beneficial because it stays active in the body longer and plays an even greater role in directing calcium into bones rather than arteries. If you're looking to boost your vitamin K levels naturally, the best strategy is to increase your intake of green vegetables and fermented foods. Even adding a daily serving of kale to a smoothie or incorporating a side of sautéed spinach into your meal can make a big difference. However, for individuals who have difficulty absorbing vitamin K from food, especially those with digestive disorders or on long-term antibiotics, supplementation may be an option. But caution is key. If you are on blood-thinning medications like warfarin, it's essential to consult a healthcare professional before increasing your vitamin K intake, as it plays a role in blood clotting and can interact with these medications. 7. Vitamin B6. Vitamin B6, also known as pyridoxine, plays a far greater role in leg strength and muscle function than most people realize. While many nutrients contribute to mobility, B6 is essential for maintaining nerve health, supporting muscle repair, and ensuring that the body effectively utilizes protein to build and maintain muscle mass. Without it, even the strongest muscles can weaken over time, and simple movements like standing up from a chair or walking upstairs can feel disproportionately exhausting. One of the most overlooked aspects of vitamin B6 is its connection to nerve signaling and coordination. When B6 levels are low, these signals can become sluggish or misdirected, leading to numbness, tingling sensations, and even unsteady walking patterns. Many older adults mistake these symptoms for aging-related muscle loss, when in reality, their bodies are simply lacking the right nutrients to maintain proper neuromuscular function. Another crucial function of vitamin B6 is its role in preventing inflammation-related muscle fatigue. B6 helps regulate inflammatory responses in the body, reducing muscle discomfort and keeping the legs more flexible and resilient. If you've been experiencing persistent stiffness or slower recovery after activity, increasing your intake of vitamin B6 might be a game changer. Beyond muscle function, Vitamin B6 is also vital for red blood cell production. These cells transport oxygen throughout the body, fueling muscles and ensuring they have the endurance needed for sustained activity. A deficiency in B6 can lead to lower hemoglobin levels, which means your muscles may not receive the oxygen they require, causing early fatigue, heaviness, and reduced stamina. If you've ever felt unusually tired after short walks or light physical exertion, it could be your body's way of signaling a need for more B6. Where does this essential vitamin come from? Thankfully, B6 is abundant in a variety of delicious and accessible foods. Poultry, fish such as salmon and tuna, bananas, potatoes, chickpeas, and fortified cereals are excellent sources. Incorporating these foods into daily meals can naturally replenish your B6 levels, supporting both nerve function and muscle strength. For individuals with digestive issues, poor nutrient absorption, or dietary restrictions, B6 supplementation may be necessary to achieve optimal levels. The recommended daily intake of vitamin B6 varies by age and gender, with older adults typically needing around 1.5 mg per day for women and 1.7 mg per day for men.